Welcome back to Things You Don't Know. I'm joined as always by Dr. Deneen and Chandler Foster. And today we're diving into something you've probably seen at the airport, maybe, side-eyed a little, or in other places too. Talking about support animals.
Oh, we're doing this? The emotional support peacock conversation?
You know, Dr. Deneen, that actually happened in Brooklyn in 2018. An artist tried to bring a peacock named Dexter on the United flight and got denied.
And that moment kind of crystallized the public debate, right? Are support animals legitimate therapeutic interventions? Or has this whole thing spiraled into absurdity?
Spoiler, folks, the answer is both.
Uh-oh.
And the history is way more interesting than most people think.
Okay. So let's start at the beginning. When did humans first think, you know what would be helpful? An animal.
Well, you could argue that it's ancient. There's evidence from 12,000 years ago, humans being buried with dogs, suggesting a bond that went beyond utility, but formal therapeutic use. That's surprisingly modern.
You know, Chandler, the first documented case is actually from the 1700s. The York Retreat in England, that was a Quaker run mental health facility, let patients care for rabbits and chickens. The idea was radical: gentle activity, some responsibility, and connection to living things.
Yeah, this is in an era when the standard treatment for mental illness was essentially institutionalization with minimal therapeutic intervention. So incorporating animal assisted activities was genuinely progressive.
And then we get Florence Nightingale in the 1860s, who wrote about small pets reducing anxiety in psychiatric patients. She specifically recommended them for people with chronic illnesses.
Wouldn't you know, Florence Nightingale, the inventor of modern nursing and emotional support animals.
Yep.
Yeah.
The real acceleration happens post World War One. Soldiers returning with what we now recognize as post traumatic stress disorder, combat related psychological trauma, began working with dogs in rehabilitation hospitals. Germany was actually the first to formalize guide dog training for blinded veterans.
The U.S. catches up in 1929 with Seeing Eye. And that's the first American guide dog school. And that's the template trained animal. The specific task, recognize disability.
Okay. This is where it gets confusing because legally, not all support animals are the same.
There are three distinct categories, and people conflate them constantly.
Category 1, the most well known, are service animals. Under the Americans with Disabilities Act, these are dogs, and in some cases miniature horses, trained to perform specific tasks for someone with a disability: guiding a blind person, alerting a deaf person to sounds, detecting an oncoming seizure.
Yeah, wait. Miniature horses? You sure?
Oh, yes, Dr. Weaver. See, they live longer than dogs, 25 to 35 years. And some people are allergic to dogs or even have religious objections. Wow. They're also incredibly strong and steady. There are people with mobility impairments and use them for balance support.
Service animals have the broadest access rights. They can go almost anywhere the public can go: restaurants, planes, even hospitals.
Category two?
Now, these are therapy animals. Now, they're trained to provide comfort to multiple people in institutional settings, hospitals, nursing homes, schools after a trauma. The handler is usually a volunteer, and the animal doesn't have automatic public access rights.
And then there's the one everyone argues about, emotional support animals. An ESA is prescribed by a mental health professional for someone with a documented psychological condition. The animal's presence itself is the treatment, not any specific trained task.
So, an emotional support dog doesn't have to do anything except exist and provide what we'd call social buffering and anxiolytic effects through its presence.
That's correct, Dr. Weaver, and that's why the legal protections are narrower. ESAs get housing accommodations under the Fair Housing Act. Landlords can't refuse them even in no pet buildings, but since 2021, airlines have been able to treat them as regular pets.
Now, essentially, that is the post Peacock rule. The Department of Transportation changed the regulations after a flood of dubious ESA claims, people bringing snakes, spiders, and even pigs on flights with a letter that they bought online for just $75.
Which undermined people with legitimate clinical needs.
As with so many things, exactly. And that's the tragedy of the abuse. It created backlash against people who genuinely need and benefit from these animals.
So let's get into the empirical evidence. Is there robust support for animal assisted interventions, or are we looking at placebo effects and confirmative bias?
Well, Dr. Weaver, the evidence is actually solid for certain applications. Let's break it down. How about it, Dr. Deneen?
Sure, Chandler. Let's start with the physiological effects. Multiple studies show that interacting with dogs lowers cortisol, the stress hormone, and increases oxytocin, which is associated with bonding and calm. Blood pressure drops and heart rate slows.
What we're seeing is downregulation of the hypothalamic pituitary adrenal axis, the body's primary stress response system. The presence of an animal appears to modulate sympathetic nervous system activation in ways that parallel human social support, sometimes actually exceeding it.
Yeah. And one study at UCLA found that heart failure patients visited by therapy dogs showed a 24% decrease in epinephrine levels compared to those visited by humans alone or just left alone, period.
So the body is literally responding differently to the animal's presence.
Yes, sir. And the neurobiological mechanisms are becoming clearer. We see activation in the prefrontal cortex and limbic system during human animal interaction. Regions involved in emotional regulation and reward processing. That's the system we're talking about. The oxytocin release isn't just a feel good phenomena, it actively inhibits amygdala reactivity, which reduces fear and anxiety responses.
And if you think it's just dogs, oh no. A 2015 study found that cat owners have a 30% lower risk of death from heart attack.
Yep.
That's quite a remarkable number, Dr. Weaver.
Yeah, it is.
Yeah. The mechanism isn't fully understood, but cats seem to revive similar stress reduction benefits.
Speaking of cats, there's actually something specific about cat purring that researchers find intriguing.
That's absolutely correct. And we did do a podcast that mentioned this also.
Yes, we did.
Cats purr in a frequency range, typically between 25 and 150 hertz. This is relevant because frequencies in the 25 to 50 hertz range have been associated with bone density preservation and soft tissue healing in orthopedic research. There's speculations that the vibrations may promote tissue regeneration. And I might add that other studies have shown that 25 to 50 hertz is also the frequency range that the columns in many of the ancient prayer rooms emanate if they're tapped.
I think that's absolutely amazing, Dr. Weaver. So I guess it's really true what they say. Cat purring might actually have physical healing properties.
Absolutely. I believe it. The
Me
evidence
too.
is preliminary, but it is interesting. Studies have shown that vibrational therapy in these frequency ranges can stimulate osteoblast activity, bone building cells, and promote wound healing. Cats evolved purring for communication, but it may have secondary physiological benefits for both the cat and the human in contact with it.
I would like to add just real quick here. I once had a cat when I had an earache or my ear was giving me trouble and she was purring, I would lay my head down on her and it would soothe my ear.
Mm-hmm. I believe it.
Yep, me too. So when your cat sits on your lap purring after you've had surgery, it might not just feel good, it might actually be doing something.
Yes, we do need more controlled studies, but the biomechanical plausibility is there. Some researchers have proposed this as one reason cats recover from bone injuries more quickly than dogs, despite having similar activity levels.
That's right. And what's really fascinating to me is that calming effects work even when you can't verbally interact with the animal. Watching fish in an aquarium lowers blood pressure. Being in a room with a calm dog works for people with neurodegenerative conditions who can't necessarily pet or engage actively. And I have to add, too, feeding the ducks can be very therapeutic for your soul.
Chandler, a lot of people won't actually recognize or know that at Emory and Henry, there's a pond. It's called the Duck Pond.
Yes,
Uh,
sir.
and they have swans and ducks there. And students they go there over that little bridge and just feed them.
Actually, yes, they do.
Yeah.
We love it.
And well, it's been going on for a couple hundred years there.
Yeah,
So, yeah. One of the most remarkable developments is animals that detect medical emergencies before they happen.
oh, yes. And this is where it feels almost science fiction, except it's not. It's actually documented.
Let's start with seizure alert dogs. These dogs can sense an oncoming epileptic seizure minutes before it occurs and warn the person, giving them the time to sit down, move to safety, call for help.
Yeah, what's interesting from a neurological standpoint is that we still don't fully understand the detection mechanism. The leading hypotheses involve subtle changes in scent, volatile organic compounds released through sweat and breath during the preictal phase, or micro changes in behavior and movement patterns that the dog perceives subconsciously.
Absolutely. Now, some dogs do this naturally without training. They just start alerting, and the owner realizes the pattern.
Diabetic alert dogs are similar. They can detect hypoglycemic and hyperglycemic episodes, lower high blood sugar, through scent changes. Studies suggest they're detecting isoporine, a chemical whose concentration in breath changes with blood glucose levels.
The sensitivity is really quite remarkable. Some dogs can detect blood sugar fluctuations 15 to 30 minutes before a standard glucometer would show abnormal readings. For people with hypoglycemic unawareness, where the normal warning symptoms don't occur, this can be pretty much life saving.
Absolutely. And here's what surprised me: cats can do this too.
Thank you,
Wow.
Chandler. I was going to bring that up. There are documented cases of cats alerting their owners to blood sugar problems, pawing at them, meowing insistently, following them around until they check their levels.
Yes, indeed. Cats have approximately 200 million olfactory receptors compared to our 5 million. 200 to 5. They're absolutely capable of detecting biochemical changes. The difference is that cats seem to be less trainable for some people for formal alert work. So, what we see is cats who spontaneously develop alert behaviors because they're attuned to their humans' physiological traits. And I know that that's true because I had a cat that did that. I have diabetes, and yeah, if my sugar was off, she was all over me, would not leave me alone.
So basically, your cat might be monitoring your health whether you know it or not. You may not even know it.
Well, I know that my ISIS definitely judges me when I drink a lot of lime coke and my other health choices. Does that count?
Oh, I think it
Mm-hmm,
does.
mm-hmm.
And there are also dogs trained to detect allergens, alerting someone with a severe peanut allergy before they encounter the substance. Dogs that can smell certain cancers in breath or urine samples. Dogs that detect oncoming migraines.
The migraine detection is particularly interesting because migraines involve significant prodromal neurochemical changes, shifts in serotonin, dopamine, and norepinephrine. Those occur hours before pain onset. Those changes presumably alter scent in ways that dogs and cats can perceive.
So we're essentially outsourcing medical monitoring to animals whose sensory capabilities far exceed our own.
Yeah, and I don't think we have the total answer on that yet. I don't think it's just scent. I think there's another activity in process here, but it'll take research. Anyhow, their continuous presence of these scents means continuous monitoring. A glucose monitor gives you data points. Absolutely. A cat or dog that's attuned to your physiology gives you real time surveillance. So let's move on. Let's talk about psychiatric applications because this is where the research gets more complex methodologically.
PTSD is the most studied area. Dogs can be trained for specific interventions: nightmare interruption, tactile grounding during flashbacks, and even crowd control in public spaces.
Nightmare interruption. This is when the dog detects the physiological signs of a nightmare and wakes the person. For veterans with trauma related sleep disturbance, this may be quite transformative.
That is correct. What the dog is detecting are changes in movement, vocalization, and likely perhaps some scent associated with REM sleep disturbance and sympathetic activation. The intervention interrupts the consolidation of the traumatic memory loop and prevents the cascade from becoming a full night terror.
Crowd control is really one that was quite interesting to me. The dog positions its body to create space around someone in public who's becoming overwhelmed.
For someone with hypervigilance, always scanning for threats, unable to relax in crowds, having a dog create a physical buffer while also scanning the environment can reduce that cognitive load.
Yeah, it's essentially offloading a vigilance function to the animal. The person's threat detection system can downgrade because the dog has assumed part of that role. We see corresponding decreases in anxiety symptoms and startle responses. And I might say that in terms of nightmare intervention cats, if you have ever noticed, if you touch a cat when it's asleep, boom, it's instantaneously awake,
Yes, sir.
right?
Indeed.
Yes,
And
sir.
and so cats are very, very quick to alert to those kinds of things too.
That's where the expression with somebody with quick reflexes, that's where the expression cat like reflexes comes in.
Yep.
Yeah. So you had mentioned anxiety. Well, what about anxiety and depression more broadly? See, that right there, that's where emotional support animals come in.
A 2016 study, Chandler, found that 74% of pet owners with mental health problems reported their pet helped them manage symptoms. But it's harder to control for confounding variables.
Yeah, the mechanisms are plausible. Behavioral activation through care routines, social facilitation, provision of unconditional positive regard, and physical touch, increasing oxytocin. But establishing causation rather than correlation requires longitudinal studies with appropriate controls. And those are kind of difficult when the intervention is a living creature.
And there's also emerging work on autism spectrum application.
Mm-hmm.
Yes, dogs and cats can help with sensory regulation and serve as social bridges.
Kids on the autism spectrum often find it easier to interact with their peers when a dog is present. The animal is a shared focus, a source of calm, a conversation starter, and a buffer.
From a neurodevelopmental perspective, the predictability of animal behavior is key here. Human social interaction involves the theory of mind, reading subtle facial expressions, and navigating ambiguous social rules. Animal interaction is more straightforward, less cognitively demanding, less anxiety provoking, which can serve as a scaffolding for building social skills that transfer to human contexts. Okay, we should also discuss the range of species involved because it's not just dogs and cats.
No, it's not. Let's take capuchin monkeys for an example. This is a real and fascinating program for people with severe mobility impairments, quadriplegia, advanced MS. Capuchins can be trained to perform complex manual tasks like flipping light switches, retrieving dropped items, and opening bottles.
An organization called Helping Hands has been placing these monkeys since the 1970s. They train them for years and they can work for 25 to 30 years with the same person.
Yeah, that is amazing. And if you ever get the chance to see that in action, you'll be gobsmacked. The fine motor capabilities of capuchins exceed what dogs can do. They can manipulate small objects, turn pages, scratch an itch. Yep, yep, yep. Tasks that require dexterity rather than strength.
The catch here is that they're pretty expensive to train, and you have to be comfortable with a primate in your home. They're also technically wild animals with complex social and psychological needs.
We mentioned miniature horses before. They're legitimate service animals under the ADA, but there are also therapy farms using goats, alpacas, even pigs for institutional settings.
Horses, in general, equine therapy has strong evidence for helping people with physical disabilities and psychological conditions. There's just something about the motion of riding. It provides sensory input that's hard to replicate.
May I just say briefly, I did that for some years, and That's quite right. It was a wonderful experience.
It is, and riding horses gives you a kind of a peace and a relation to an animal that I dare say you don't have with other animals.
Hmm.
Yeah. Hippotherapy uses the horse's movement as a treatment modality. The three-dimensional motion of the horse's gait provides proprioceptive and vestibular input that can improve core strength, balance, and motor planning. For children with cerebral palsy, the evidence base is quite substantial. And I do want to say something else too. They have used horses for prisoners, right? We've all heard that and seen that. The most striking thing is that horses seem to be able to predict recidivism in criminal activity far before humans do. In other words, what happens is a horse will not trust and make friends with somebody who is going to be a recidivist.
Amazing.
Hmm.
What about rats? I've seen videos of people with emotional support rats.
Well, Dr. Deneen, rats are smart, social, and trainable. They can learn to respond to emotional cues. But the thing is, they don't have legal recognition. So you're kind of in regular pet territory there. No housing accommodations, no public access.
Yeah, it's the same with reptiles, birds, and rabbits. People genuinely bond with these animals and may experience measurable physiological benefits, but the legal framework only covers dogs and sometimes miniature horses for full service animal status. Well, let's address the elephant or the peacock, if you will, in the room.
Haha.
There, yeah, there's genuine skepticism about this space.
Some of it, I have to admit, is deserved. The emotional support system got massively exploited. You could go online, pay $50, have a 10-minute phone consultation with someone claiming to be a therapist, and get a letter certifying your pet as an ESA.
Oh, yeah, people would do anything, man. People did it to avoid pet fees, to bring their dog on flights, to get around breed restrictions and housing. And, believe it or not, it backfired because some of those animals, they were untrained, they were aggressive, or just simply inappropriate for public spaces.
That's very true, Chandler. There were terrible incidents of ESAs biting people on planes. The turkey, the pig that defecated in an aisle, the hamster that a woman flushed down a toilet because Spirit Airlines wouldn't let it board.
I have to tell you, by the time all that happened, I'd have PTSD from dealing with the service animal.
I know what you mean.
The pushback hurt people with legitimate psychiatric conditions who benefit from animal support, but don't have disabilities requiring a trained service dog.
Well, now hold on. There has to be a middle ground here.
One would hope. Some advocates want a tiered credentialing system, ESAs requiring more documentation, animals themselves passing basic behavior standards, not full service dog training, but enough to ensure safety.
Yeah. What about methodological critiques of the research?
That critique has some merit. Many animal assisted therapy studies are small, poorly controlled, rely on subjective self reports. Double blind studies are impossible when the intervention is a golden retriever.
True, but the physiological measurements are more robust. Cortisol levels, heart rate variability, blood pressure, and neuroimaging data. Those aren't subjective. The argument isn't that animals don't help, it's that we need more rigorous research to understand dose response relationship, which populations benefit most, and what the active ingredients of the intervention actually are. Okay, we've covered a lot of ground. I want to end on something more personal. We've discussed empirical evidence of policy, but this is ultimately about human lives.
You know, my uncle actually has a friend, because my uncle's in the military, and he has a friend who has a service dog trained for PTSD. And I spoke to him, and he said something that stuck with me. The dog doesn't judge. The dog, he doesn't ask questions. He's just there for every nightmare, every panic attack. He loves unconditionally. And that's enough for me.
You know, Chandler, there's something very profound about that kind of relationship. Animals don't require the social performance people do. For people managing trauma, mental illness, or disability, that can be healing and transformative.
Yep. From a psychological standpoint, animals provide what we might call unconditional positive regard without the complexity of reciprocal human relationships. For someone whose capacity for trust has been compromised by trauma, or whose neurological differences make human interactions exhausting, that can be genuinely therapeutic.
And then there's the responsibility aspect. Having something that depends on you, needs feeding and walking and care, structures a day for people who might otherwise struggle to find reasons to get up.
It's biodirectional too. Dogs in service roles show lower stress markers than typical pet dogs, possibly because the work and stimulation keep them engaged.
Yeah, that's really true. Though we should maintain epistemic humility about the animal's subjective experience. We're interpreting their welfare through behavioral and physiological proxies.
Final thoughts, everyone?
Support animals at their best represent something humans have known intuitively. Our well being is connected to other living things. Science is quantifying what we already feel.
And we need policy frameworks that take legitimate clinical applications seriously while preventing the exploitations that undermine them. The solution isn't to dismiss animal assisted interventions, it's to professionalize the space.
So the next time you see someone with an animal and find yourself wondering if it's legitimate, then maybe assume good faith. The person dealing with an invisible condition does not owe you an explanation.
Unless it's a peacock or a hedgehog, you can still ask about the peacock.
Oh, Dexter deserves so much better, man.
We,
Uh,
all righty. That's our show for today. For Dr. Deneen and Chandler Foster, I bid you adieu for today. This has been Things You Don't Know. Come on back and see us again right soon.